Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another of our Bryan Health Radio podcast interviews with Melanie Cole.
When planning to undergo surgery, patients can speed up post-surgery recovery by preparing both physically and mentally. Prehab can quicken the healing process and help minimize the loss of function following surgery. My guest today is Nick Reimers. He's an exercise specialist and in charge of the Prehab program at Bryan LifePointe. Welcome to the show, Nick. People have heard the term rehab for years, but what is Prehab?
Well, Melanie, Prehab is a preoperative exercise program here that is geared towards preparing people for surgery, whether it's improving muscular strength or cardiorespiratory fitness or any number of comorbidities such as diabetes or along those lines, to help improve those risk factors to help them have a positive outcome.
So what kind of surgeries would Prehab be indicated for?
Well, what we're looking for when we're doing our Prehab program is people geared toward total knee surgeries, total hip surgeries, or any surgery that a doctor feels that they need to improve their physical fitness going into surgery to help them have a positive outcome.
So what's involved and how early do you start Prehab? If you know you're going to have a knee replacement in 6 weeks or so, how much time does somebody need to start Prehab before they go into surgery?
Well, the way we have geared our program is we want to have enough time to see positive changes in health outcomes, if it's weight change or improvements in strength or improvements in cardiorespiratory fitness. So we like to go about 8 to 12 weeks out with our program to allow for significant changes. We want to have positive outcomes with this program.
So then what's involved? Somebody comes to see you, and what can they expect?
Well, we'll start the program. The first 4 weeks we'll focus on kind of an aerobic-based training type of program where we'll focus on improving their stamina. We'll try to get them up and going, and that's going to help us with the benefits we'll do later on in the program. And then we'll work more into muscular strength and while doing flexibility training the entire time.
So if someone has limitations, as in the case of maybe hip surgery or knee surgery, can they still do this cardiovascular and cardiorespiratory type exercise? What do you do with someone that has limitations?
Well, we just have to find appropriate exercise. When we're looking for somebody that has limitations, for instance, if they have knee pain, hip pain, or there are any contraindications for doing specific exercises, we have a number of machine services here at Bryan LifePointe that we can accommodate almost any type of demand, whether it's getting in the pool and doing aquatic exercise to minimize impact, or if it's hopping on a new step or some type of low-impact exercise device that will help us complete exercise without exacerbating pain.
And how do you measure whether or not they're having good results while they're doing this program?
Well, Melanie, what we do is we start with a pre-assessment. We go through, we do some base testing of range of motion, of strength, height, weight, those types of things. And then at the end of the program, we do those same assessments, those same tests, see what kind of progress. And then ideally, we'll track them later on to see how their surgery outcome came out.
And do people tend to do well in this program, even if they're nervous about surgery, Nick, and that's what they're thinking about and getting all of the things they want to think about before they go into surgery? Are they thinking about themselves and their own health?
Well, surgery is a big process, and it creates a lot of fear in a lot of patients who are thinking about going through with it. And so our goal here is to help them, to teach them, to prepare them physically and mentally. And so as they go through this program, we're going to help them understand that they can exercise, that we don't have to be fearful of doing activity because of all the positive benefits that it has to our health. And as soon as they start to overcome that fear, then they can look forward to having a successful surgery.
What about things like dietary considerations or weight loss before surgery, Nick? Is that something that's involved in prehab?
Absolutely. We have options with our programs, both our 8-week and our 12-week program, where we incorporate working with a dietitian. And so that helps us come up with a plan of action as far as their nutrition to help them have success in weight loss.
And then you mentioned getting ready mentally. How do you help somebody get ready mentally for surgery and that fear that goes along with it?
Well, the way that we go through our health coaching is we like to set goals. We like to create kind of some goals and some expectations with our clients of what to anticipate as far as their exercise, what to anticipate as far as their surgery. And then with this program, it leads into some of the other services that Bryan Health provides, like our joint class and our preoperative exercise education to help them get prepared. And when they feel more prepared for the surgery, when they know what to anticipate, they're going to be more comfortable going into that surgery.
So does prehab ever stop, Nick? How soon before the surgery do you say, okay, you've done enough now you just need to rest it up before surgery?
Well, we would like to go as close as what the doctor would allow us. You know, this exercise is something that we want them to continue to do right up until surgery, and then even after surgery and when they complete their rehab, to continue on with exercise. And hopefully they take on those behavior change skills and continue exercising right up to and after the surgery.
So tell us about the Bryan LifePointe Prehab program, Nick. Tell us, how does somebody sign up?
Well, the best way to get started in the prehab program is to ask their physician if it's something that's appropriate for them. If they've been working with a physician and they've decided that surgery is something that might be appropriate, but maybe down the road a little bit, to have the physician put the client in contact with us here at LifePointe. They can call us here at Bryan LifePointe. Our phone number is 402-481-6300, and they can get a hold of me, Nick Reimers. And then what we'll do is we'll get into contact with the physician and start the process of enrolling them into prehab.
And that number again is 402-481-6300. And you can look for Nick Reimers because he will help you get ready. And in just the last few minutes, give us your best advice about prehab and why people should really consider it and why they should come to Bryan LifePointe for their prehab.
Well, Melanie, the biggest thing is when we develop something like arthritis, when we have an injury, when we have pain, the fear is that if we do something, it's going to cause more pain. When in reality, doing regular physical activity, doing appropriate exercise actually helps. It helps manage the physical signs of arthritis, but also the psychological effects. They keep you from getting depressed and keep you from feeling like you're disabled. We want people to understand that they can exercise at any point in their physical health spectrum, that they can have positive success with exercise.
Thank you so much. What great information. You're listening to Bryan Health Radio. And for more information about the prehab program, you can go to bryanlifepointe.com. That's bryanlifepointe.com. This is Melanie Cole. Thanks so much for listening.